Dr. Sang performed minimally invasive surgery on my heart last spring. We found a myxoma, which is a tumor, very rare and almost always benign, thankfully. My experience was short, sweet, and successful due to you. My husband and I, we were planning a trip on the Camino in Spain. This was like really serious, and so I wanted to just make sure that my heart was in good shape. So Dr. Gomez here at St. E Physicians said sure, and she scheduled it for me, and when I did it in early March, they found a myxoma. I explained to you that we were
500 miles.
Yes,
right?
doing 500 miles, and we were about 7.5 weeks out from when we were supposed to leave. So you said, you know what, I think we could make this happen. And in 9 days, you did my surgery, and 6 weeks later, I started the Camino, and I'm really, thankfully, you were my guardian angel here, and I had one there, and
I remember because you kept sending me pictures of your experience in Spain, and I was so inspired because just a few days before you had left for home. And so to me, it was an incredible feat you did, you and your husband did. So Patricia, tell us about you.
In November of, last year, I had a mini stroke. I'm almost 76 and I didn't even know I was born with a bad heart valve. And when you listened to my heart, you said I had the worst heart murmur you'd ever heard, and I didn't even know it. And then in May, Dr. Mario here did my heart valve. He fixed my heart valve, and I was in the hospital for 6 days. And prior to that, when I met with Dr. Mario, he showed me on the screen what he had to do, and I also saw a video of somebody who had the procedure, which makes you feel so much better, because when you're talking about having heart surgery, that's pretty scary. So when you can hear from somebody else what the procedure is like, you can see it on the screen what he needs to do, that just puts your mind at ease.
So how was your experience in the intensive care unit? Did
It's
it look
great.
like that man, like that video of the man saying that?
Oh yeah. I mean, he made it sound like it was a good procedure. I was really glad that you could do the surgery here. I didn't have to have everything opened up. That was so much, that made me feel so much better.
Yeah, and today we've come to a point where the biggest incision we make is about 3 centimeters, which is, inch and a half at the most.
Yeah.
And that's just to put in the devices that we're going to use, whether it's a valve or a ring, like you had a ring and you had a ring.
Right.
And so we can only make it so small, otherwise things don't fit and we can't get them to the heart.
Right.
And we use an endoscope, a camera. So Kim, you're not naive to healthcare,
No.
right? You have family in healthcare, lots of family in healthcare.
Yes.
Tell me about your story.
Mine snuck up on me really quick. My GP found it, Jennifer Maddox at St. Elizabeth.
What did she find? What did she find?
She just put the stethoscope down and she said, Kim, I don't know what I'm hearing today, but you're jumping and flopping and clicking. She said, you've earned yourself an echocardiogram ASAP. I saw Dr. Reichert, his office was great. He said, I got a guy that does mitral valves you might want to see. I was a little hesitant. I put it off for about 8 months. Ooh. My heart was only working at 45% and all of the blood was coming out the top. And it's such an emotional thing to talk about because it is your heart.
It's you, right?
Yeah. And you touched it and you're sitting here and I'm still sitting here.
you not only healed us, our body, our heart, you also gave us that knowledge, that feeling, and to know that we're going to be okay.
The assurance.
The assurance is amazing.
I can't take the credit for it all because I do an important part of the experience, but it's a system. I am as dependent on different specialties that help us during the operation, the anesthesiologist, the nurses. They're the unsung heroes of open heart surgery because you can't do open heart surgery without them.
I feel like the nurses, everyone, the transport even people, they all really take their job seriously. They care about the patient, but they're dedicated to the well-being of each and every patient.
They were right there for you as long as it took. They're assuring you about your surgeon, they're assuring you about your anesthesiologist. Everybody's 5-star in what they do, and the integrity that they do it with is not, it's not purchased, it's not bought, it is inside that person. They genuinely, authentically are giving that to you with nothing in return except for your better health.